So welcome everybody. I'm Shannon Rudisill, the Executive Director of ECFC. If you haven't joined us before, this is part of our every other week series. We're calling it First and Third Thursdays. And we have a number of topics that we're covering, but I would say the thing that we're doing the most this year is talking about how we're making social change, how we can make social change for children and families. And we are looking at both inside and outside strategies. So, you know, if you were with us 2 weeks ago, we heard from Acting Deputy Assistant Secretary for Early Childhood Development, Katie Ham. We'll be inviting future administration officials as they get appointed. But we also want to acknowledge that to get to where we are right now, to get further and to create accountability, we need public support and public will building and organizing and advocacy. So we balance our sessions across those kinds of things. And today we're really excited to learn from the folks who delivered one of the biggest social changes that we have seen in quite a while, the Affordable Care Act. And we're very excited that, as I say, our own Barbara Chow, one of our ECFC leaders, is going to moderate this discussion for us. Barbara is the director of the education program at Heising Simons Foundation, previously directed education at the William and Flora Hewlett Foundation, and served in senior roles with the Domestic Policy Council and the Office of Management and Budget in the Clinton administration. And she is deep into this work today, and Heising Simons is a huge contributor and leader within our Raising Childcare Fund. So I will turn it over to Barbara.
Great, thank you. Thanks, Shannon, and thank you to both you and Rachel for coming up with this idea. It's a terrific idea. I just want to start with a little context setting, and that is just a very exciting moment for early childhood. It really feels like this is a time in which the field is rising. It is rising in the public consciousness. It is rising as an issue of racial and social justice. It is rising as an urgent policy priority, as you'll see in half an hour, and I've already seen in terms of the actions of Congress. And I think what's really particularly exciting is that it has broken through politically. And we saw evidence of that with with Elizabeth Warren's campaign. So it's really coming on the sort of central national stage in the form of these presidential commitments in ways I think that had not happened before. So that's particularly exciting. The path to this point, I think, was really built by every single person on this call. I can sort of scroll through the names. And so I think you all deserve a huge note of congratulations for the kind of place that we are at today. So the question I think right now is, you know, how do we channel this momentum to achieve equitable and durable structural changes in the early childhood field and systems? I think, as many of you know, the $40 billion in the American Rescue Act, built on top of the $10 billion in the CARES Act, will provide really critical, immediate kind of stabilization and relief, but it will not provide the kind of long-term structural transformative changes in improving workforce compensation, universal access, the kind of systems, high quality systems change that so many of you have been supporting and advocating for. So it's a moment, I think, for us to ask ourselves, how do we take advantage of this unique sliver of time to secure the sort of breakthrough gains that are not only necessary, but I think now possible? To answer this, as Shannon said, we've got this incredible panel. They, you know, come from a field that faced and rose to a similar challenge. And you'll hear more about their experiences in both kind of funding the launch of the healthcare fight, how it became operationalized, and then how it's been defended since then. We're joined today by three amazing speakers. The first is Gara LaMarche, who's the president of the Democracy Alliance and the former president and CEO of Atlantic Philanthropies. We'll next hear from Richard Kirsch. He is the director of Our Story, the Hub for American Narratives, which is an amazing site. I just took a look at it around progressive narratives. And the former national campaign manager of the Healthcare for America Now, HCAN, which you're going to hear a lot more about. So HCAN refers to this organizing communications effort that Shannon referred to. And last, Margarita George, the current executive director of HCAN. So our format for our time together is this. We'll have about 10 minutes with each of our speakers discussing the different stages really of this healthcare campaign, beginning with a funder role with Gara. Then we'll shift to the elements that made the HCAN work, this campaign work, and conclude with what it takes to defend legislation, which, as many of you know, has been under kind of relentless attack ever since it was enacted. Then we'll open this up to Q&A, and you're all very experienced Zoom users, so you know how to use the chat, so that we'll both use the chat, and if there are opportunities, we may also open it up for questions or comments. But with that, I think we're going to start with Gara. So Gara, let's just really start by hearing more about the funder role. Everyone in this call has had lots of experience, obviously, working with their foundations and with their boards on making investment decisions, both as kind of the how and the what. In our prep call on Tuesday, I think you said that Atlantic, I think I got this right, had not been particularly involved with healthcare, but made this bet well before it was clear that it would be the centerpiece of both the Obama presidency, campaign and presidency. So when you think back to that process at Atlantic, what can you share about your early vision? How did you get folks on board with this big bet? And how did you know that this was the right time to make a push for universal health care?
Thanks, Barbara. And it's great to be here today with all of you. The story of Atlantic and healthcare is a little unusual, as you've alluded to. You know, Atlantic was a global foundation in spend down mode. So we had a multi-billion-dollar endowment that we were trying to get to zero within a 10-year period of time, and also an unusual capacity to fund advocacy and a desire to fund, campaigns. Although that capacity hadn't really been very robustly used before I got there. And one of the things that the board wanted to do in hiring me, because I'd come from the open society world where we had a lot of policy work, was to ramp that up. And my instructions from the board were to try to make big bets and to try to, make an impact in the limited life that Atlantic had left. So Atlantic, as you noted, was not known as a healthcare foundation particularly. We had a public health program, or we call population health program, that was one of our 4 big program areas globally, but it operated primarily in South Africa and Vietnam, not in the United States. In the United States, we had some work on aging, some of which touched on health. We had a youth program, some of which dealt with the CHIP program and trying to expand access to that, the children's health insurance. But we were not like, let's say, Robert Wood Johnson or Commonwealth or some of the healthcare conversion foundations like California Endowment or California Wellness. We were not identified as a healthcare foundation. What we were was a foundation that had a social justice vision and who believed, in engagement in policy and to try to make some big changes in the social safety net. So I think the story of Atlantic's involvement is not so much a story, frankly, of Atlantic's vision. And I don't know whether this will be useful or not to the folks on the call. It was really more of a story of being reactive and responsive to the vision of others. So what happened was, and this has been chronicled in various places, is that several organizers and activists of my acquaintance from earlier parts of my career came to see me a couple of months after I took over Atlantic. One of them was Roger Hickey from the Campaign for America's Future. Another was Jeff Blum from US Action, the organizing network. And they had a proposition, which was that this was now 2007, the middle of 2007. And a year and a half before the 2008 presidential election. They had this notion that the biggest gap in the social safety net, healthcare, which the Clintons had been the most recent to attempt in the early 90s and failed, was something we really needed to make a push on. And they wanted to launch a campaign heavily centered in organizing and grassroots activity to build support so that the next president would feel both the support and the pressure to deal with comprehensive health care reform. And I don't know whether the name had been picked at the time, but that became HCAN, Healthcare for America Now. And I don't know, it was an audacious request in many ways because they had quite a grand vision that would cost tens of millions of dollars. And Atlantic wasn't a foundation that had been identified with that. At the same time, they knew me from the work we'd done together. They knew my values. They knew where the board and I wanted to take the foundation, and they were right to ask. And I thought about it, and we decided, well, what are we here for? We have a big endowment. We're trying to make an impact. This is something that could leave a lasting impact if it worked. And that was the beginning of the story. I think the other thing to say just at the outset is that there were other efforts, building to try to make healthcare both an issue in the 2008 election and something that could be acted upon with a new president in early 2009. And we, in fact, considered some other approaches and over the course of the couple months when we were considering this. What drew us to HCAN was a broad coalition, as you'll probably hear more about, of organizing networks, religious groups and labor groups and women's groups and civil rights organizations, and it was comprehensive nationwide and many, many stakeholders. And it was grounded in a field operation that was bottom up and that operated, if I recall correctly, in 49 states. And one of the things that had been missing in most people's view from the earlier efforts to enact comprehensive health care reform was a strong field and grassroots operation. And that is what we ended up primarily funding. And, we made a series of grants to HCAN of $5 to $10 million and subsequently, granted $26.5 million to the HCAN effort over a couple of years and helped to raise another 20 million or so. So the effort was funded, more generously than most campaigns of that kind are, and necessarily so because it was a huge, huge undertaking with many sources of opposition.
Thank you. You've answered a lot of my questions. I guess one, just to sort of drill in a little bit. You said that you had provided the 26.5 million over a series of, it sounds like several different grants or renewals. What triggered one renewal to the next? Especially, I think, what triggers it when you don't know whether you're actually making progress because things are not moving legislatively?
That's a very tricky question, in advocacy grant making. Between my Atlantic years and my Open Society years, I don't know, whatever it was, 15 years total of funding these kinds of things. This came up a number of times because between Atlantic and Open Society, we were the biggest funders of immigration reform, among the biggest funders of immigration reform, of criminal justice reform, of work against the death penalty, of financial reform. So at the same time as the HCAN was going on, in the early months of the Obama administration, we were the biggest funders of the financial reforms that resulted in the Consumer Protection Board and also of work around a progressive approach to the stimulus at the time. So we were doing a lot of things that interacted with policy, but none quite at the scale of what we did with HCAN. And, when you are a funder at some level in partnership with these movements, and I guess the first thing I would say is that while I've said on many other occasions as somebody who's a practitioner, but to some extent a critic of philanthropy, that the language of partnership is often kind of obscures the power dynamic that funders have. I mean, let's face it, you have money, they want money, and better to be honest about that than to pretend that it's a partnership in the ordinary sense of the word. But in the best sense of the word, you're working closely with the advocates. They trust you, you trust them, and you're in constant conversation. So I had a guy on my staff. First, it was Stuart Scheer, who had been at the Robert Wood Johnson Foundation before and knew his way around healthcare. And later, after he left, it was Steve McConnell, who had also been a great, healthcare advocate, particularly in the aging realm. And they were the point people, for the grant. They were in regular contact with the HCAN people about strategy, tactics, not to micromanage, but just to understand the grant and be available to their needs on an ongoing basis. We didn't always agree, but and Richard can speak to this more better than I can. But, we tried to be supportive and tried to provide the resources when they needed it. The trickiest part of any campaign like this is when it doesn't seem to be going well. And my board was very willing to make the big bet, but, got nervous because those who followed healthcare reform will remember that for reasons beyond our control, but that we tried mightily to affect, it took longer. There was a kind of a fruitless effort at a certain point in the, what was it, Richard, the Senate Finance Committee, I guess it was, where Senator Baucus was the chair of the committee, and he believed that he could get Chuck Grassley on board with the bill in a bipartisan way. This will sound familiar to many people now. That was not to be, and I don't think it was ever to be, but it cost a lot of time, and it allowed the opposition to build, and the Tea Party, grew up. And over the course of the effort, time was very costly, and there were points at which, it seemed like it wasn't going to happen. And when when you've spent 10 or $15 million on something that might not happen, there's a temptation to pull the plug and say, well, let's not throw good money after bad. And it's not that there wasn't a temptation or that I didn't feel some pressure periodically from my board about it, but we stayed the course, and I'm glad that we did. So, I could go in maybe in the conversation later to the considerations that you have about it, but I'll say one other thing about this, which is that when you are funding an organizing effort that builds power at a state and grassroots level, you are building something that endures beyond the policy change. We happened to get the policy change, not as robustly as we wanted. There wasn't a public option. We had to make some compromises along the way within the context of the vision that we funded, but we made we accomplished something significant. But even campaigns that don't accomplish their ultimate goal, where the reform fails, that are grassroots efforts that really involve people at the grassroots level, you always leave something behind and build for another day, even if you lose that particular battle. And that's why we were more attracted to a theory of case that was about investment in organizing and power building.
Thank you. Thank you, Gaura. That's so helpful. So I think we're out of time for this segment. We'll come back to some of these really interesting questions and sort of shift to Richard, I think, next, who took these resources and this idea and made it happen. So how did you make it happen? Can you describe kind of what were the elements? There's I think a lot of interest as we think about our efforts right now in early childhood about if we were to reproduce this, like how much does it cost? What are the key elements, and sort of what are the relative costs of the different ones, which are the most important, which are things that, you may have spent money on, but turns out to be less important ultimately to the outcome. So maybe let's just sort of start with how did, what those elements are and how did you operationalize this?
Sure. Thanks, Barbara. And it's, again, great to be with everybody. I'm glad you're focusing on this. And I want to say, I wrote a book about this. And one of the reasons I wrote the book was so other people like yourselves, as well could learn from this, as well as campaigners. Because there's so much we did, and I wanted that to be for the historians, but also for practitioners now. And I know Margarita told me that the Sunrise Movement had a big discussion about the book, and that made me feel really good because that's the kind of transfer I'm hoping we had. So we spent about $47 million in 2 years. The biggest chunk of that was on field. We also spent a lot on paid communication, a little less. And that's, I think, in a lot of campaigns, not as important, but in this case, had to. What's significant, though, is we spent only 14% of the budget on central operations. So field was many times larger. And that's very important in terms of the theory of change and power building, as Gaura was talking about. So I think there were two things that, the two things that really made us work were the coalition building and the staff that helped or coordinated, and then the field operation. And in bringing the coalition together, we organized around a set of principles that were had a very strong both policy and political lens. They were designed to do what we knew we needed to do to win the policy, and also to keep a powerful coalition together that would be interested in that policy. They were also designed to distinguish between people that weren't as willing to take on power. They didn't want to take on the insurance industry, for instance, which a lot of people in healthcare were willing to do. There's a lot of elements that go into any kind of issue. We were the tip of the spear. We created the power to win. And the coalition was principally not healthcare groups. In fact, there wasn't a single member of the steering committee that was primarily a healthcare group, although many had, important healthcare histories. And it wasn't because we exclude healthcare groups. Principle is because our interest was mostly about organizations that were capable of moving people on the ground. And at that point, there was the beginning of Netroots organizing. So we did that, but it was, we had Move On as the one organization at that point developed to do that. We did have a couple think tanks, and they were helpful, and the policy work's important, but we're looking for groups who can move things on the ground and who had serious buy-in. And I'll talk in your next question about that buy-in. So the staff was about coordinating that. And the staff was also about helping make the place we're made by far our biggest investment field. And Margarita was the field director and really primarily responsible for driving this. But we knew from the beginning, we would not win this inside the Beltway. Best we could do was neutralize, have enough lobbyists, enough paid advertising to neutralize the huge opposition. But we would win it outside the Beltway by really building power there. And so we did a very extensive planning process. Margarita and a couple of colleagues from other organizations. Margarita then was not working for us. She was working for SEIU. This is a coalition. Someone from the field director, organizing director at US Action, and an organization called the Northwest Federation of, I forget they changed their name now, but anyway, looked at the capacity in every state, who's on the ground, what organizations have capacity, who don't. And that was part of an extensive planning process in a lot of other ways that allowed us to identify groups on the ground that had the ability to move. Again, maybe not healthcare, but could move people. And we'd signed contracts with those folks, didn't sign grants because we wanted accountability. And then we built a unified strategy. Again, this is important that centrally we're building a strategy, but that the field around the country was part of building that strategy, both through their leadership nationally, but also in each state, with flexible tactics to meet the strategy. We actually stood up a small business organization in terms of resources. We knew that one of the main reasons that the Clinton effort lost was because the National Federation of Independent Businesses was strictly opposed to it. They don't really represent small businesses. They represent conservative ideology and big business, but they have this cover of small business. And so we actually spent money standing up our own small business organization, which made huge difference in winning. And a lot of the stories in my book are actually how those small business leaders made a difference. So that was the biggest place. As I said, we did spend money in paid advertising. But again, this was a campaign that had to do with a huge, well-financed opposition. We did it principally on ads aimed at inside the Beltway to sort of create some credibility and key swing members.
There's a lot there. Let's see. So maybe one question I was sort of intrigued by is this contract versus grant idea for accountability. What were you asking what we would call our grantees to do, and what were you holding them accountable for exactly? Was it delivering a certain number of people, or what was it?
I'm going to actually throw that question to Margarita, because she was the one who actually was in charge of that, and rather than I sort of going, MJ, why did you answer that?
Sure, I'm happy to answer that. In fact, we still do it that way. We still work through MOUs and contracts, not through grant agreements. And this is going to sound a little bit provocative to say, but one reason why we did that was because we wanted to have really reciprocal accountability on the campaign.
Enter your meeting ID followed by pound.
So, we are trying to build a culture of reciprocal accountability where the state organizations could hold us accountable for a strategy that really made sense. And we could hold them accountable for not just sort of advocating for change, but actually influencing change. And so on this campaign, we had a set of deliverables for every group that created consistency across the field. The deliverables were very, very rigorous. Lots of data, lots of numerical, the voter file the voter model that exists on the voter file right now was built largely through HCAN. And so it was very metrics oriented, a lot about sort of measuring volume and quality of work. And it's just much harder to do that through a grant apparatus than doing it through MOUs. The other thing, frankly, is, as Richard said, most of the organizations in our coalition were not healthcare groups. That was even more true for the field. We had probably half of our groups had never worked on healthcare, and way over half had never worked on any healthcare that was private insurance, right? If they had worked on healthcare, it was the public programs like Medicaid, Medicare, CHIP, not on regulation of private insurance. And so part of the work with these groups was sort of getting them up to speed on doing that kind of work. And for a lot of the groups that we worked with in the field that didn't have background doing healthcare work, it really helped to have contracts, because some of them, a few groups here and there would just decide, this isn't really for us, or they couldn't meet their deliverables, and we wanted the flexibility to be able to terminate the contract. We didn't do that very often, and a couple of times groups actually came to us and said, we can't meet these metrics, which is, perfectly fine, but we had a pretty rigorous standard across the field. So for groups that at some point decided we really can't do this, we can't work through a program that's this rigorous, it gave us the flexibility to then give those partners an out and go seek out some other partners if we needed to do that.
Now, I want to add one thing and this also reflects what Gareth said at the end of his comments. This built extraordinary capacity, and groups that had never, there are things they'd never done, like we had groups that had done a lot of community organizing that had never actually learned to get lots of calls into members of Congress, or organize meetings with members of Congress. Basic skills they just had never done. We even had the labor unions who, supposedly are good at moving the members. The key leaders and 2 labor unions said they got much better than they ever had at moving their members. They didn't have a contract with us. They were helping to fund the campaign. But the example of their being part of the field and the kind of rigorous but respectful operation that MJ and her colleagues ran built capacity throughout. And again, even if we hadn't won, that would have been true. And it still is a lasting legacy that continues.
Yeah, thank you, Richard.
Yeah, I would say, I know I'm taking you, it built muscles of collaboration that have endured across a variety of issues. And as you look at childcare, which is another huge cross-cutting issue, affects almost everybody in the society, the lesson of not seeing it just as a narrow issue for people who see that as their particular focus, but something that everybody has a stake in, is a good lesson.
Yeah, thank you. It does bring to mind questions about whether or not the more traditional healthcare groups and the new organizing groups were, had like similar strategies, tactics, and even goals. And to the extent they did not have the same strategies, tactics, and goals, what role, Gaurav, did you play, or what role did funders play in trying to kind of bring them to a more organized, set of goals?
I've lost track of whose section this is. I want to horn in.
I know. We were still talking kind of back to. We had a few more questions for Richard. It's actually been great hearing from.
Yeah. No, why not? There's already beginning to be some comments in the chat. Well, look. There are pros and cons to this. Well, not cons, but the Atlantic gave a lot of money, right? So because we realized that the effort, we had the money, we were a big foundation, and we realized that the effort would take, some scale. I think one of the challenges in our field, in philanthropy, is that people, even big foundations, often try to do big things with very little money. and they underinvest, or they say, this is really important. We have this whole plan to transform X, and here's our $2 million, and who else wants to get in? And, and that often falls short, at least because of the scale of our initial investment. Even if nobody had come in, $25 million, $26 million, nothing to sneeze at. So we did raise money from work from our foundation. By the way, one of the things that been mentioned is there was also skin in the game by some of the groups involved. If I recall correctly, some of the big, some of the participants in the HCAN coalition put their own resources into the effort. And we also, if I recall correctly, believed that because it was necessary to have a lot of different groups at the table, we also helped to subsidize the participation on the steering committee of some groups that didn't have quite the scale of resources as a big group like a Planned Parenthood or whatever, or a labor union. So we approached my former boss, George Soros, who also hadn't been involved in healthcare, but saw that it was a real opportunity to make a big difference in the social safety net. I think Soros put in something like $5 million. Bob Ross at California Endowment is one of the most visionary, foundation leaders around. And he, though their primary focus is California, he recognized how important this was to everything they were doing. He put in some millions of dollars, and some labor unions did, and a number of foundations did discrete things at a smaller level. But it wasn't, and this, obviously everybody can't play this game because not every foundation has $25 or $30 million to throw into an effort like this. But I would say that the effort to think big and to get those resources in at scale is a really important one.
Yeah, thank you. So maybe back to Richard and then on to Margarita. A few more questions, Richard. Just any lessons learned from your kind of experience setting up HCAN, things that you would have done differently, things that worked well. Maybe I'll get my second one out as well, and that is your funders. Now that this is long in the past, you can be completely honest. Was there anything that you was particularly either helpful or unhelpful about the foundations with whom you worked?
So, I mean, I said what worked really, really well was this tremendous ownership that because the whole campaign, when we were doing the organizing committee, the plan was written, and I insisted on this because someone said, let's hire a campaign consultant. I said, no, we're going to write this ourselves using the Midwest Academy strategy chart. And over a series of weeks, we did that. That created tremendous ownership. Steering committee members had to put money in and huge resources. And as Gary said, there's some places the groups didn't have the cash. We helped them with that, but that was only because there was a certain very particular role we wanted to be sure. And because they built, so we had a couple lobbyists. The lobbying was done by the organizational lobbyists. The field work, we had Margarita and a deputy and a couple of state consultants. The rest of the field was all working for other organizations. So this was a true owned effort. And then the second, and every level, and then again, the field, and really for a lot of the reasons that Margaret was talking about, was really successful. Some things didn't work. We actually had an 867-page plan. 160 was text, the rest were data. We did that with a planning grant from Atlantic in a collaborative effort in 2 months, believe it or not. And not all of it worked. We had a whole big business plan. It turned out you couldn't get big business. The small business plan really worked. We had a grass tops plan. It turned out to be not that important. The grassroots plan really mattered. Frankly, the fundraising plan, we raised a lot of money, but a lot of the fundraising work didn't work for a whole set of reasons, which if you want, I can talk about. But we raised the money we needed, which is what mattered. And then in terms of the relationship with Atlantic, it was really good. It was very mutually respectful. We talked every week or two with whoever the staff at Atlantic. They had good questions. Sometimes they challenged us, but not in a way. And one of the things is the people, Gary, doing this actually understood what we were doing and understood politics, which is helpful. And it was clear we were going to respect each other. And I just want to, there's a story, there's a chapter in a book called Did the White House Try to Get Me Fired? The answer is yes, because we really were unhappy with some of the things going on. But the important thing in both these levels, both in terms of the leadership of the organization and in terms of Atlantic, was the decisions that we made that pissed off the White House were made by the steering committee, not by the staff. And so they totally, totally backed me. And when the White House let Atlantic know they were unhappy, they totally backed us. So I just want to emphasize that, since that's what really made this whole thing work so well.
I just have to do anecdotally, as Richard knows, I got called, and we work closely with the White House around a number of things. And so I had good relationships in Atlantic, and I got summoned, to the White House by the Chief of Staff's office during the thing, effectively to say, call off your dogs, as if somehow HCAN was working for us, because I think they were putting a lot of pressure on Baucus in his home state to move the bill out of committee. And first I said, we don't control HCAN, and we wouldn't seek to control HCAN. That's not the nature of the relationship. But number two, why are you upset that they're trying to get your bill out of committee? I understand why you might not be publicly trying to, give a hard time to Baucus, but they're doing it. That helps you. But they, even the Obama White House, and maybe especially the Obama White House, they're all about control. And they didn't see it as helpful, but actually it was helpful to them, and in ways. And I think the people in the White House many of the people in the White House who were close to the campaign understood that. Nancy M. DeParlo, who was healthcare czar, said a number of times that HCAN was, the pivotal factor in getting it done.
Oh, thank you, Carl. So another lesson learned: back up your grantees, I think. So let's move on to Margarita to hear more about kind of current day HCAN. ACA has been under attack, as we know, multiple times, and your organizations had to fight back many times. Can you tell us more about how you activated your network? And also, I know that there's been you have a lot of questions around the revenue climate right now, and which is a necessary precondition to more support, more funding for childcare or lots of other progressive issues.
Sure. Well, I'll say that I really did not expect to be working at HCAN right now. I don't know if people know that we actually retired HCAN. We had a very deliberate strategy to run a campaign, pass the law, defend it, and start implementing it, and then go away. We were never built as a permanent organization. And the reason that we brought HCAN back was because of the unfortunate election of President Donald Trump. And to sort of echo what Richard was saying about the deep commitment that organizations had to the Affordable Care Act, that the unbelievable constituency that we built across organizations that largely had no healthcare background before HCAN, we were able in 2017, so Trump was elected at the end of 2016. In 2017, it took us about a month to bring HCAN all back together and stand up a field operation. And we did it with no money, right? Essentially, I think Richard and I were going to have dinner because Richard was going to be in town. And Ethan and I, another colleague, were walking down the street together, just thinking about the apocalypse that was the election of Donald Trump and wondering whether we should really be on our way to Costco to buy water and toilet paper. And as we were walking by SEIU, we said, you know what? No, we should go into SEIU and talk to our colleagues. And we brought together a number of people from the National Steering Committee and said, well, Trump had been very clear that his first priority was going to be to repeal the Affordable Care Act. He ran on it. It was a promise to his base. We pretty quickly reassembled our national coalition partners. I basically got on the phone with all of the groups, and within a month we had a day of action, and then we were rolling from there. So that's not really magic. It's from the very beginning of this campaign, it was built, as Gareth said, to be durable, right? That the outcome was going to be more power and capacity for organizations. Organizations developed tremendously through the campaign, and they remembered that. And because we were a coalition and a field operation of multi-issue groups working on healthcare, we have capacity to be nimble in some ways that other organizations are not. So for instance, HCAN came back together during 2017. We were sort of the lead group fighting to stop the repeal of the Affordable Care Act. And then at the end of 2017, what happened was the healthcare fight became the tax fight, which actually we expected. We had actually expected that the ACA repeal bill was going to be a tax bill. So we were a little bit surprised that the ACA repeal bill was just a straight up ACA repeal bill. But we knew that it became clear that they were not going to be successful repealing the Affordable Care Act outright, that the next place they would go would be taxes. And in fact, the challenge to the ACA in the Supreme Court that's pending currently is based in the tax law, in the Trump tax law. And it is around the individual mandate, which we have seen many times before. So over time, we have come to see these two issues as very intricately connected, and certainly to move to the next phase of the Affordable Care Act. And we just saw some great things happen in the American Rescue Package with, the most robust version of subsidies in the ACA, huge amounts to incentivize the expansion of Medicaid in the 12 states that have not yet expanded. And our goal is really to make that permanent and move as far as we can with affordability on healthcare. That is going to depend largely on the what happens in tax reform and whether, in fact, President Biden is successful in raising the $4 trillion in revenue that he says he wants to raise. And so we have become so connected to the tax fight because it has been so integral to the healthcare fight. In fact, the tax coalition that we work with very closely was modeled on HCAN. And at the time that I was running HCAN, after passage of the law, I ran the tax field and the healthcare field at the same time, and all of our partners across the field worked together on healthcare and taxes. So it was another way to leverage the capacity and assets that we had built at HCAN and to be able to leverage those assets for the next phase of the fight, which we're in now. And, hopefully childcare will get to the same place where we'll pass robust policy and then be in a situation where we're struggling to fund more and more of it, right? Because that would be a great place to be.
Yeah, thank you. I know that we want to also move to questions from everyone else here, but it does, just listening to you all talk, it does make me wonder whether there's a more direct relationship between HCAN and early childhood. If in fact there was not that deep connection to healthcare in the first place. I mean, does HCAN want to adopt early childhood as a topic? Is there a way of building on the coalition that you have already created?
I think that's a really important question, because one central thing that I think HCAN did from a power analysis point of view that a lot of other groups didn't do is they recognized early on that you need a constituency beyond your issue area to leverage enough power. Right. So that is, we would not have won healthcare if we hadn't gone out to 1,000 other groups who are not healthcare groups and said, hey, you have a stake in this. Let us connect the dots for you. Why don't you become part of this fight? Which is sort of how we got to this place. And we have done that on other issues. We've done it with SNAP. We've been doing it with paid family medical leave. We've done it with reproductive rights, right? Many of the groups in our network and remember, we are a grassroots network, so most of our organizations spend, 70% of their time organizing grassroots members for advocacy, public education, and political efforts. A lot of the groups in our network who said 10 years ago, we don't really work on reproductive health care and rights, they do now because we figured out a way to work on it, right? And we help people understand how integral that issue is to a larger dialogue and policy that really creates the opportunity for economic equity and gender and racial equity for people in this country. So, I mean, I think given that we have a lot of flexibility in our network, I could see that. I could see our groups that represent a lot of low-wage women, a lot of women that have lost jobs because of childcare in this pandemic. We're very sort of heavily skewed towards sort of gender and racial equity work in the field. Potentially that is possible, but I think any which way, whether it's HCAN or others, it would be very smart for childcare advocates to look beyond your immediate sort of, circle of folks and think more broadly about who you can get invested in the fight that brings additional capacity.
Can I just say, to build on that for a second, is that I think it's a truism when you work in this on social justice stuff and you have a and that you support grassroots organizations at the state and local level, that those groups rarely have the luxury of specialization. So, you look at national groups that are often focused on, a particular lane. And one of the things that was accomplished in HCAN was to, if you will, to foster a greater sense of intersectionality and connection. And that was really, really important. But when you get to a group in, Virginia or Michigan or North Carolina or New Mexico, wherever it might be, Arizona, those grassroots groups are by definition working on a variety of issues. They're not only focused on healthcare, they work on economic justice and childcare, whatever. So when you get to the level that you really need to move change in this country, you're talking about groups that are by definition kind of multi-issue groups.
They also allow you to combine just at the very granular grassroots level, people with different perspectives. I know you on the agenda, you talk about both early childhood education, childcare, and paid leave. Well, there's overlap, but there's real distinctions. There's people with young kids who most care about childcare, and there's people in the sandwich generation who most care about caring for their parents, and there's people with disabilities in their family. So, but rather than thinking about, who are we going to find here, we're going to find there, if you actually have grassroots organizations, their members are going to have all those characteristics. And as they look for more people with those characteristics, they're going to build their membership. So it's that kind of synthesis builds power, and also means you're going to get away from the siloing that, I'm working with childcare providers, or I'm looking for parents who have kids in childcare. That's really hard to do. It's hard to find those folks, but you don't have to if you work with organizations that actually have real relationships with people on the ground.
Thanks. Well, let us, I know we're kind of almost at the end, but there are folks that have questions, I know. So Shannon is one, and I saw some others in the chat. There were a few other questions. You want to start, Shannon, or?
Sure, and I see Andrea Peluso has a raised hand, so I know you can, it's hard to watch all that. So maybe I'll go and, so the question I have relates directly to what you guys were just talking about, which is, I can imagine a struggle between the people who've been deeply, deeply in the weeds on something for like their whole careers and care a lot about details, right? And then inviting in a lot of people who have broader interests, but might be novices on the weeds of the specific issue, right? And like, I mean, you could paint that negatively and say territorialism or turfism, but I actually don't want to do it that way, right? Because there's something to be said for somebody who devoted their whole career to something, and then suddenly a bunch of newbies are in it. Like, how did you balance that out?
So let me talk about one particular way we did this. So we spent a lot of 2008 doing our 2008 campaign was a very powerful field campaign that got 140 sitting members of Congress to sign on to a set of our policy principles. But while that was going on, we had our policy staff leading a very intensive process that went into the first quarter 2009 of having policy discussions with our members. And there are a bunch of our member organizations who really did care about policy. And that's important. When we got to legislation, we wanted to be sure we understood the policy choices. We wanted all to understand between our members of the coalition where there is agreement, where there are differences, and anticipate that all beforehand. So we've been talking about field because that's the power, but it wasn't like we didn't understand that policy details were important in terms of actually improving people's lives and in terms of also, so we spent, and so in effect, I'd say folks who care about that can have a role, and an important role appropriately when we actually get to what goes on in the lobbying and the policy discussions. And so that's we have ownership. But I will also say that our steering committee was under no illusion that facts or policy make any difference when you're trying to fundamentally make change. And I'm probably offending a bunch of people. I'm doing that intentionally. I'm overstating it only a little bit. I mean this because you don't build power with facts or policy. You build power the way we've been talking about it, and then put policy and facts in a position to actually move. And if you don't understand that, you'll continue to have great policies and great facts and no change.
But can I put that in a slightly different way that is marginally less offensive? That is, no, the way I looked at it was there's an ecosystem of change in this world, for any issue you want to deal with if you're a funder. And that ecosystem has different parts in it. And one of them is policy. One of them is work and what is the best healthcare system, or what's the best childcare system, whatever. And most funders are more comfortable at that level, right? And so therefore, when we came into the healthcare fight, enormous amounts of work have been done over many years that, by the way, without which I don't think what we were able to do with the grassroots stuff would have worked. The groundwork had been laid by funders who cared a lot about policy, and the policy was not the lack. The funding for the policy, the thinking for the policy was not the lack, which isn't to say there aren't hard decisions to be made along the way about what is a compromise that that helps you live for another day, or what's a compromise that guts, those are complicated strategic questions in any campaign. We felt, and I think the animating premise of HCAN is that not to scant policy, I don't slight policy, but that you can't get it done without organizing muscle and power building. And power building is something that many funders traditionally, it's changing and has changed a lot in recent years, are not as comfortable with. And unless you invest in the power building part of it, your policy can go nowhere.
Thank you. Andrea, just to kind of move on, I know you had your hand up for some time, and I'd love to turn it to you to ask your question.
Yeah, I think it's more of a reflection, and I really appreciate the last comment, because I think it's really important to note how often we're building campaigns on top of existing organizing infrastructure that has historically been very underfunded and undersupported. I mean, many of us who are doing this like long-term transformational organizing, I do think it's shifting, and thanks to many partners in the funder collaborative like yours. But historically, I think like we're often building campaigns off of infrastructure we didn't support and help to build. And then, maybe less so in HCAN, but in other efforts, sort of pulling away as soon as the kind of policy victory is won, and not remaining engaged around both the implementation, but also the ongoing defense work that's so important to this kind of an effort. So I just want to make a pitch for like really emphasizing the importance of on the ground organizing work and sustaining the investments in that kind of infrastructure over a really long time, so that you can scale campaigns on top of it, when there's key and important moments to do it. And I think I just also wanted to note that I feel like, and this is not specific to kind of the HCAN campaign at all, but I have noticed in my time in the field, I'm in Oregon, by the way, that the field is shifting to some degree, like the way we're organizing these kinds of campaigns is shifting, and to kind of lift up the model of the Childcare for Every Family network that's developing in true partnership with and kind of leadership from on the ground state power building, base building organizations, and kind of in the Beltway, DC based campaign organizations with the kind of shared leadership of parents and providers feels like an important sort of development in the way we're looking at campaign infrastructure going forward.
Can I just, one quick thing? One of the things I learned we learned at Atlantic and the healthcare fight was that we thought we were coming in, despite the massive scale, just to kind of fund a campaign that other funders hadn't funded. And we would then, if we got the victory, we'd leave the field and everybody else could worry about implementation. With respect to healthcare, as everybody in this country knows, the law was endangered and assaulted from the minute it passed. And so, Atlantic had not planned actually to spend any more money after the campaign was over. But we kind of had to, with the litigation and all the kinds of things to defend the law for a couple of years afterwards, we had to stay in it and should have probably been prepared to stay in it. So, I mean, the healthcare is unusually totemic issue in American society on the right. I don't know whether childcare reform, would excite the same kind of dyed-in-the-wool opposition for 10 years afterwards. Maybe it will, but I mean, I think people need to be thinking ahead past victory to sustaining the victory in the world in which we live.
I want to jump in on Helene's question about HCAN sounds like it was very directive, and if so, we're not communicating clearly. I want to emphasize that the steering committee and the field felt real ownership. So when Margarita was talking about accountability, it wasn't like, we're telling you to do this. What made the accountability work is because the field actually planned what is going on. They were part of figuring out the overall strategy. And then they were hard at filling the tactics. And what we would tell people in each state is, if these tactics don't work for you because of your particular politics, tell us what will work. And MJ and her staff, Margarita and her staff, would work out tactics that worked in that state. So it wasn't directive. It was really collegial, but it was also accountable. And the accountability, and sometimes people feel like they're being held accountable. That's being like putting power on them. It's different. And I know we're almost out of time, but Margarita is the person who lives with this and does a brilliant job of a very important tension.
Look, I would just say most people want to be accountable. We do. We did to our partners. We still do. And our partners want to be accountable. We're working on a shared plan to win a really big thing that is going to impact our members every single day. So we didn't have very many problems with accountability. We still don't. And because we have a shared power analysis, so we have a shared understanding of what things get us the power to advance our goals, it's pretty easy to have these conversations. And we can say to a group, we think it's this, right? We're trying to win something big in the Beltway. We think we need to do this. Often groups will come back and say, yes, yes, yes. Oh, but we need this variation because our member happens to be Joe Manchin, and we have a point of view about that, and they'll express a rationale. But, you know, we built a language in the campaign and a shared sensibility about how to have those discussions. And at the end of the day, this was hard work. This campaign had a lot of money. Trust me when I say we got far more work and commitment out of these organizations than we ever paid them for. And in fact, as we started to run out of money, and we went back to our organizations and said, we have less funding now, but we need you to work twice as hard. Not one organization said no way. They all jumped in to do as much as they could to win this really important thing. So there was a strong shared community, and I would sort of echo, Richard, don't be afraid of accountability. And you're running a campaign, you should have a plan, right? It's not a choose your own adventure thing. There is a plan, but everybody can have a role in that plan, and you can move forward together in a very positive way and build a thing that really has become an enduring thing.
Shannon, I know we're at time. Should we conclude? We were going to have a last word, tweet length kind of a sentence from everybody, but I don't know if we even have time for that. What do you think?
I feel like we are at time. This was so rich. I'm getting, some private chats like, we want to know more. Give me like, so we'll regroup as a group about, different ways to extend this without drawing too much on the time of our colleagues who've been so generous with their time today. I think we should really just thank you so much. This conversation was fantastic. I've got notes and a lot of additional questions in my own head, and we'd already talked a couple times. And for others, I just want to let you know what we're planning. Sometimes we use these Thursday afternoons just to have a peer sharing, and the hot topic is certainly the American Rescue Plan and implementation of that. And so we know so many of you are working on that, and we want to serve a role in helping you coordinate and bringing information to you. So we're gonna have a peer sharing to sort of tell you how we've organized ourselves to work on the American Rescue Plan, hear what you're thinking about in your states, and we're looking for that in 2 weeks. But Barbara, Richard, Gara, and Margarita, thank you so much. And I think that this has really opened a lot of our eyes to little parts of this social change that we hadn't thought about before. So thank you very much.
Thank you.
Great, thanks to you
All right.
guys.
Thanks a lot. Thank you.